Yeah, that's amazing. And Bobby, how do you overcome the challenge of a specific knowledge and multidisciplinary teams? Because sometimes for innovation, we know that there is this challenge on balancing knowledge versus diversity. How do you balance that out?
Well, this brings us into a part of this that I'll have to explain a bit of knowledge theory and information theory. But if that's okay, I can share a bit of context here. So,
Sure,
uh,
please
Sure,
do
go
it.
ahead.
there's a wonderful book by Dominique Faure on the economics of knowledge. And if you see Dominique Faure's work in the history of theory of knowledge, um, Dominique Faure is the protege of John Seeley Brown's co-author, and John Seeley Brown wrote The Social Life of Information and On an Exponential Culture of Learning. And these are two related frames: on an Exponential Culture of Learning and Dominique Faure's Economics of Knowledge. And if you connect these two together, so what you learn from economics of knowledge is that the liquidity premium of tacit information grows exponentially as all other knowledge becomes commoditized or Googleable. Everything that is Googleable is commoditized information. Everything that is tacit knowledge is scarce. Now, if you look at where the study of the economics of knowledge intersects inequality, what you see is that tacit knowledge concentrations are one of the most dramatic causers of inequality because it's only limited networks that have tacit knowledge. Because tacit knowledge you need to have trust with enough for a conversation with, or a lunch with, or a relationship with, and it doesn't automatically release itself in the Google wild. It's just accessible only through humans. And that has allowed, because the liquidity premium of tacit information grows exponentially compared to all other information, it has created this context of knowledge asymmetry in global city capitals, and this is part of a global challenge. Now, the point of this in terms of social innovation is if you connect this to the Leibniz challenge. So Leibniz was the last person in Europe to be able to teach every course taught in Europe in that time. So all fields taught at all universities in Europe, Leibniz could teach several hundred years ago. No one since can teach all the courses, can master all the courses, and so there's an underlying scarcity. Now, the scarcity is actually addressable because if you have each social innovation as a center point and identify every field that intersects it, that's 100 people plus that intersect any social innovation I've ever met. That's why we say every organization on the planet, every social innovation adopter has a 2 order of magnitude micro leadership role diversification gap. They need to create 100 times more roles for stakeholders to participate in their micro social movement in support of the social innovation. And that allows us to address the Leibniz challenge. No one can know all the fields. And if you're a social entrepreneur, you're going to be missing 95% of the fields that indirectly intersect your work. Maybe if you're lucky, you're master of 50% of the fields that directly intersect your work. But the point is that you're never going to have that level of knowledge dominance vis-a-vis a social innovation
Hmm.
as a Leibniz unless you leverage the tacit knowledge networks. So how do you leverage the tacit knowledge networks? That's on a New Culture of Learning, the John Seeley Brown book. You can see it's basically creating a radical agency through iteration, through data self-awareness, data collaborative awareness, peer support, and bonding social capital within adventure teams. So effectively, in the social innovation movement, we've had a conflation often of bonding versus bridging social capital. And what we need the bonding social capital for is to get people into micro leadership roles over time. That's a bonding kind of structure. What we need
Hmm.
the bridging social capital for is for, say, Canovo to social innovation replicate. Canovo replicates one social innovation a year from the rest of the world to Latin America. They bridge to a social innovation on the other side of the world. Or I bridge to someone who connects this and that wonderful thing together. And that's a bridging social capital role. And for social innovation, what we need is effectively bonding social capital among the 100 fields that connect any social innovation gap in society in order to have impact potential be realizable proportionate to social innovation theoretical impact potential.
Great, great. I imagine that's exactly what we are doing now, right? Connecting the, the bonds here of the knowledge across. And talking a little bit more about the how, Bobby, do you use specific tools, or do you think it's less about the tools, it's more about the discipline and about how do you keep people engaged to share the knowledge and to have meaningful impact? Because it's not just sharing knowledge, but working together towards impact, right?
So the way to think about the tools is it's proportionate to the intra-disciplinary professional norms. So if we work with project managers and don't leverage the parts that are useful from existing project management process, then they get frustrated because we're too discontinuous. Now, we don't say that we want to use everything from the expectations of each of these traditions, because project management as a field should consider the interests of stakeholders and not just perception management of stakeholders. And we don't want to just reuse the fields and the tools, but where the tools from startup world can be reused, we often have adopted. We have day-to-day used Google Drive and Google Meet, and we've used Slack for 15,000 messages, for example, within our medicinal foods team. We've had about 30 Trello boards that we've used to coordinate on some other teams in terms of Kanban and wish lists. And we've, within the data science and machine learning team, we've had definitely a set of code on Bitbucket that we've used, and created some maps of reusable libraries from different parts of the open source community that are connectable to the project, and scrapers and spiders that can be reused for the sake of public health. This is our medicinal food citizen science to understand sleep, stress, and anxiety in terms of what foods and herbs can be beneficial for people to address that, and in what combinations, and with what chance of effectiveness, and how can we change the evidence base of medicinal foods to reach parity with the pharmaceutical world. So that's one set of tools that, in a context of a team, we use. I mean, we use a lot of Excel in the financial modeling. Our financial modeling collaboration, in the case of biophilia, have y'all heard the term biophilia?
No.
Uh,
Have you heard?
Biophilia is love of plants, love of nature, and it turns out it pays for itself. So this is an example that I'll walk through. So if you see Alexander, have you ever seen a vertical garden?
Yeah,
Yeah,
Okay.
yeah.
So that's what we're talking about with plant walls. It's one way
especially in
of.
the cities, right?
Yes, exactly. So what we did is a simulation for any hospital to say, could they become covered with plant walls, 3% of all the square footage across the hospital, and allow 90 minutes a day of time with plants for doctors, nurses, and patients. And we've been able to, 5 days a week, and we've been able to simulate that prevents 500 deaths over 20 years and 5,000 major medical events through reduction of opioid addiction, reduction of painkiller use, reduction of heart attack, stroke, and cancer and asthma, and medical mistakes being one of the largest financial parts of that. But the point is that that's been 18 months of spreadsheets and interdisciplinary resource, and in that case, 95% of any part of our model does not get contained in any one source in the world. So in other words, each of the different studies of this before had looked at this outcome or looked at that outcome. They had never woven together all those dimensions. And so we've been able to show that the plant walls pay for themselves in 10 months in the hospital, because
Wow.
all those outcomes come together. And so we think that's an example of this disciplinary fracturing where we don't know the impact potential of a social innovation because we haven't looked at it in the way that you can, which is each module of it in terms of the evidence of effectiveness of that dimension over time and related contexts, and then integrating that together. There is WISIP. If you all look at the Washington State Institute for Public Policy Cost Effectiveness, but that's only for social interventions. What we need is the same mindset of impact potential analysis for every social innovation in the world and every social innovation gap vis-a-vis any stakeholder. And we think that's where all of this becomes feasible. We're working on the concept of, if you've looked at, you've heard of the term reinsurers or retrocessionaires.
Yeah, reinsure, yes, but
Reinsur-
retro share.
Retrocessionaires are the ones who buy the risk from the reinsurers. So
Yeah.
the
Okay.
the last step of the third, yeah, insurers, reinsurers, retrocessionaires. So what we have identified is there's $100 trillion a year of insurance industry being securitized approximately globally, and of that 0% is prevention oriented. 0% of the derivatives market for insurance includes the prevention of the risk. They're all just investing the resources to save when the risk happens. They're not actually looking at how to reduce the risk, whether it's California forest fires or flooding in Florida or health risk in any part of the world. Um, Really, the risks are preventable through social innovation. And so, we're connecting that together to say, there needs to become in the future a prevention derivatives market in which social innovations can flow to where they prevent harm across stakeholder categories. And that's something that is missing as a structural innovation. So in each of these cases, there's a social innovation thesis in terms of what is the underutilized capacity in the world. In the case of prevention derivatives, it's underutilized opportunity to prevent harm. In the case of zero subsidy affordable housing, it's that you can have people buy a fraction of the appreciation value. We've conflated appreciation value and use value of assets. And if you let people buy a quarter of a house or half a house in terms of the future sale price, but the whole right to live in it, then it actually has worked for every Stanford professor for 60 years. And we think it could work for lots of other categories of people. And that's an example where underutilized capacity is that we haven't fractured a financial model that has broken people, and that there's an opportunity to do differently. Solidarity economics is where the externalities of doing good pay for themselves for shared value calculations for every stakeholder. And if we look at the solidarity economics potential of social innovations, it's saying where are there stakeholders who should pull the social innovation into where it's needed through collaboration rather than just social innovation as push, where the social entrepreneur is the only one trying to put it everywhere.
Yeah, that's great. And if we go back to the micro leadership model, what are
Yes.
the main challenges that you currently see, and what are the key success factors that you would say are most relevant?
Yeah,
Well,
and if possible, contextualize just a little more the concept, of micro leadership.
so if you have a human that takes responsibility, it can be a wonderful thing and it can be a painful thing. And so I'll explain that by way of an example. There's a volunteer of ours who had been serving food at a soup kitchen context and as a donor volunteer, and had always seen the line longer than they could ever reach every day, and every day said that they had been growing depressed, finding that the problems were always larger than themselves. And that's partially because we don't have a clear cultural line for how an individual takes responsibility without that responsibility overwhelming them, overwhelming their ability to give, overwhelming their emotions, overwhelming them to the point where they're not able to have agency. And that's because the problems are generally pretty big. Now, in social innovation, we have the luxury and we have a different burden. The luxury is that the social innovation in theory could reach the scale of the problem. They don't get depressed just because they're never going to reach the end of the soup line. In theory, the social innovation could solve the problem. But we have the other problem, which is social innovation scope creep. Social innovation is something that inherently can swallow a human. If, as a macro leader, we see social enterprise burnout as a real thing. There's a book written about a social circle that, and a friend who, Ilya Znamirsky, who passed away in 2011, More Awesome Than Money, and that's about macro leadership.